Um, so like Elizabeth said, my name is Daniel Gray. I serve as the Executive Director for Ohio Recovery Housing, and I'm really glad to join you all today to provide you some information on what recovery housing is and how it's regulated. It's hard for me to do the PowerPoint and keep my eye on the chat, but certainly if you do have questions, throw them in the chat, and I'm gonna definitely make sure at the end we go through all of them. But if I see something pop up, I'll try to address it. But just in case you ask a question and it seems like I don't see it, I'm not ignoring you. I just might have to circle back at the end and make sure that I catch all of the questions. So, and just a little bit about us at ORH. It is our mission to increase access to affordable, high quality recovery housing for people with substance use disorders. So that is what we do here at Ohio Recovery Housing. And so we do that in a variety of ways. What we're most well known for and what we're most famous for is our certification process. We are the National Alliance of Recovery Residences affiliate in the state of Ohio. And as such, we create and maintain a review process for standards of excellence in recovery housing. So the National Alliance of Recovery Residences sets the national standards for recovery housing residences, and then they designate one entity in each state to do the work of actually going out, visiting the homes, and certifying them as meeting those national standards. And in Ohio, that organization is Ohio Recovery Housing. And then along with that, we also develop lots of recovery housing resources. So we provide training opportunities, provide advice on how to operate quality recovery housing, produce reports and guides. We've recently done some estimates on the estimated need for recovery housing within the state of Ohio. We also do a lot of education and outreach. So we want all of our decision makers to know what quality recovery housing looks like and what the outcomes of quality recovery housing are. And then we also advocate for recovery housing as a critical piece of the continuum of care for people in recovery. And we also engage in research. So we want to advance recovery housing as an evidence-based practice. And so we collect resident outcomes data, analyze that data, and use that to help operators engage in continuous quality improvement. And then we also educate and inform operators on how to use their own data so that way they can tell their own story about recovery housing. And I know recovery housing, and again, it's been in the Ohio law since I believe 2014. But still, when we look at the terms of, of all of the terms that we use and all the programs we have, that's still relatively new. I know it's been since 2014, so it's been 11 years. It's been a minute, but there's still a lot of confusion out there. It's not as well entrenched as other programs. And so we still find that there are people who are confused about what recovery housing is and what it isn't. And so I'm going to make sure we're all on the same page about what recovery housing is. And we do have a definition in the Ohio Revised Code of recovery housing. It means housing for individuals recovering from alcohol use disorder or drug addiction that provides an alcohol-free and drug-free living environment, peer support, assistance with obtaining alcohol and drug addiction services, and other alcoholism and drug addiction recovery assistance. And you can find that in Chapter 5119 of the Ohio Revised Code. And so what this means is that recovery housing is housing. So, going back to that definition, that's the first words. Recovery housing residence means it's housing. It's a housing environment. And that means there is a resident-driven length of stay. Residents have free choice in their treatment provider. They operate as a landlord, and there is a home-like environment within the home. So really critical to note that recovery housing is not the same thing as residential treatment. Residential treatment is a clinical setting that is licensed by the Ohio Department of Mental Health and Addiction Services. It is not the same thing as recovery housing. Sometimes people use those terms interchangeably, but they are different within the Ohio Revised Code. Also, recovery housing is not the same thing as an adult care facility or residential care facility. Typically, those facilities are for people with severe and persistent mental illness. And again, they're all important parts of the continuum of housing and continuum of care for people. And yes, there are many, many people who have both a mental illness and a substance use disorder, but the services and program that are offered are very, very different. And so people, if they're looking to operate a facility that is really focused on providing, assistance with activities of daily living, things like that, then that sounds more like they should get licensed as an adult care facility, whereas a recovery home is a housing environment. It's a home-like environment, and primarily serving people with a substance use disorder. And then also there is a resident-driven length of stay. So there are no arbitrary time limits on recovery housing. And there's a long section of the Ohio Revised Code here from Chapter 340 that basically says that a recovery housing residence cannot limit a resident's duration of stay to an arbitrary amount of time. So if there's a program that says, hey, this is limited to 60 days, 90 days, 30 days, whatever that is, and it's arbitrary, that is not a recovery housing residence. Recovery housing residences cannot have those arbitrary lengths of stay. It is resident driven. So that means the resident can live there as long as they choose to, and as long as they're participating in the recovery programming, they're contributing to the recovery environment within the home, and they're, fulfilling the resident agreement, then they are permitted to stay in the recovery home and live there as long as they would like. It is their home. And of course, if there are any scholarships, subsidies, or free rent offered for any time period, we require to meet our quality standards that the operator work with the resident to help them pay after their time period is over. So recovery homes shouldn't be using dramatic increases in rent as a de facto way of putting a time limit on residents' length of stay. Also critical is free choice of provider. So the residents must be able to choose any service providers, and residents should not have to automatically move out of their housing just because they stop going to treatment or their treatment program ends. And I know that treatment is a critical part of many people's recovery journey, but there are many people in recovery who find themselves on a path to recovery who did not engage in clinical treatment services. And we know from data that a vast majority of people who need treatment services don't have access to them. So there are many people who find their way to recovery without treatment. So having free choices of treatment providers or not being engaged in treatment is not something that is a requirement of living in recovery housing. And for us, it's all about choices and respecting that choice of the resident. So again, as long as they are on that journey to recovery, they're maintaining their recovery. Now they might need to access treatment services in order to maintain their recovery. But they have that free choice. Operators cannot say like, hey, you can only live here if you go to my treatment program. That is something that is not allowable under our quality standards. And then homes also operate as landlords. And this can be something that can be a little bit frustrating, especially when there are case managers or social workers or family members who are trying to find a space for their loved one or the individual themselves. And they are either experiencing being unhoused or are at risk of being unhoused, where it can be frustrating because they apply to live in a recovery home and then there might be a lengthy application process for that person to engage in before they can move in. And, some people are like, hey, well, why can't you just place them in that house right now? And that is because it is not a clinical treatment environment. It is a home-like environment. It's a home. And once that person moves in, they are considered a tenant and the organization is considered a landlord. And if that person doesn't understand, the drug and alcohol free living environment in the home, if they don't understand the recovery program and, that they'll be expected to not only maintain their own recovery, but also to support others in the home in maintaining their recovery. If they weren't expecting that and they didn't actually want that, they were just more looking for a place to be or a safe home, then, it is now their home, they're a tenant. And if they return to use or if they use substances, it can be difficult for the home to ask that person to leave under Ohio landlord tenant law. And we also don't want to do that because that might lead to an eviction, which would be negative on, both the operator as well as that resident who probably does not want an eviction on their. So if we ever, so we always try to educate people who are in the community where we fully understand and appreciate that there are some individuals who are looking for housing and they may need that housing right away. But all operators of recovery housing, need to balance the needs of that individual and also maintain the health and safety of the other individuals who are living in the home. And as they live in such a group setting, it may not always be possible for homes to place somebody right away because, again, they have to make sure that that environment is going to remain safe for everyone. And so there will likely be some sort of application process where, the person, needs to demonstrate that they're willing and ready for a recovery housing environment. And then also recovery homes offer a home-like environment. This pretty much means that recovery homes are not treatment centers. They're not shelters. They're not institutions. And so for us, we have NAR standards regarding a home-like environment. And this means that residents can receive any services that are typically delivered in a person's private home. So I know myself, I use telehealth and I use that from the comfort of my own home. So residents in recovery housing can receive telehealth services from their own home, which is the recovery home. Peer support is another service that often takes place in an individual's private home. So yes, people can receive peer support, peer coaching within the recovery home. However, things like group therapy, those don't typically take place in our homes. We typically leave the home and go somewhere else to receive those services. However, well, I guess I should say the big question to answer is, do people normally do this in their own home? And if the answer is yes, it is something that can and probably does take place in a recovery housing residence because it is the home of all of those individuals. But I do want to note here too that all of our operators, comply with the ADA and federal, so that's the Americans with Disabilities Act, as well as the Federal Fair Housing Act. So of course, if there's a resident with a disability who needs a reasonable accommodation to have a service or something brought into the home that's not typical, of course, our operators are going to accommodate that person. So again, just like any other organization, any other program or service, there's always accommodations made for individuals with disabilities, if those are needed. And then recovery housing is recovery housing. It is an illicit alcohol drug-free living environment. There's strategies for peer support, and it's for people with substance use disorders. And so the first big point here is that recovery housing is for people with substance use disorders. We often see people are confused, especially when it comes to a lot of programs that offer housing for individuals returning to the community from incarceration, which is a much needed housing type. And many of those individuals might be people with substance use disorders. They may even have like a drug related conviction, but that doesn't necessarily mean that every person that's entering the home is a person with a substance use disorder. And if that's the case, they welcome people, all people who are returning to the community from incarceration. You don't necessarily have to have a substance use disorder, then that's not recovery housing. Again, not to say it's not important, not to say it's not needed, but that's just not something that we here at ORH would certify and consider a recovery housing residence, because according to the definition in the Ohio law, the recovery housing residence is for people with substance use disorders. And of course, they can serve any secondary population. So yes, if they are serving people with substance use disorder who are also returning to the community after incarceration, that's great. We also have one home that serves individuals who have a substance use disorder and also have an eating disorder. And again, that's their specialty population that they choose to serve. But of course, everyone in the home is a person that identifies as a person with a substance use disorder. And then they also offer an illicit drug and alcohol-free living environment. And this applies to the entire property. And it's not only saying like, hey, please don't use drugs or alcohol when they live here, but there's policies, procedures, and strategies in place to ensure that the residence is alcohol and drug-free. and that any incidents or disruptions in recovery are addressed immediately and appropriately. And there's another myth out there that in order to be ORH certified, in order to be a recovery home, you must evict people who have a disruption in their recovery. And that is not accurate. Actually, we highly encourage people to do everything in their power to keep that person actively housed and actively involved in recovery support services or other services. Now, the situation does need to be addressed. And so usually this looks like saying like, hey, what other services and supports can we offer? Making sure the person learns from that lived experience, and there are systems put in place to help support that person. So that way, if at all, the situation can be prevented in the future. So they're going to update their recovery plan. They might provide additional supports. That person might agree to attend additional meetings, or they might agree to be assessed by a clinical treatment provider and follow through with any treatment recommendations at a treatment provider of their choice. So again, it can't be ignored or brushed under the rug, but it doesn't necessarily mean that a person must be evicted from the housing. Of course, there are some situations where it is, no longer safe for the other residents, for that person to be housed. And in that case, the operator may engage in the eviction process to have the person evicted from the property, and that must be done in compliance with Ohio landlord tenant as well as Ohio eviction law. So just want to make sure that, again, that is definitely a myth that's out there. We highly encourage and have lots of best practice guidance to support operators in appropriately addressing those issues, but we would want to see people re-engage in recovery supports and recovery housing if that's their choice, if they experience a disruption in recovery. And there are also recovery support activities happening in recovery housing. And this may vary on the level of support, but kind of the foundation of recovery housing is a recovery plan. So each resident establishes their own recovery plan that's separate from any treatment plan they might be getting in clinical treatment services. And these are resident directed plans where they set their own goals, and then the operator provides any assistance to help them reach their goals. And many operators use SAMHSA's 8 dimensions of wellness to assist people in identifying goals. So their goals can be anything. It could be, I would like to get a job, and the operator can connect them to appropriate job services or help them develop a resume or help them find jobs to apply for. And then, their goal for that week might be they're going to apply for 2 jobs. And then the next week they check back in. They say, hey, how did that go? Did you, do you need any support? What's your goal for next week? Or their goal could be something like, hey, I want to drink more water. So my goal is to, drink 2 of my, emotional support water bottles worth of water, every day. And, that's a goal that they want to work on, is to, something related to their physical health. So the goals really can be, and they're designed to be resident directed, whatever the resident feels that they need. And it's really about building that skill, that skill of setting goals, identifying goals, and achieving those goals, and then having a community around you that supports you in those goals and that you can reach out to for support. There's also a focus on developing relationships and leadership. Because the big thing about recovery housing is that the residents themselves are the leaders in the houses. So they are the ones that are building this community. And so we want to see homes where the physical environment is set up to support resident interaction. So homes have common areas where residents are encouraged to spend time and hang out with one another and gather and talk and do fun things like watch movies or play games, and visit with their, families and visitors. And then also there's defined strategies in place to allow residents to support one another in recovery. And of course, there are certified peer supporters, which offer, a defined certified peer support service. This is what I consider, informal peer support. So it's, it could be going around at a house meeting and having everybody share, something that they were successful at during the week, and that's something that they're struggling with, and letting other residents express support. Some homes have buddy systems where, the residents live there longer might provide support for a newer resident. And so these things aren't the same as like a certified peer support service, but they are all about like creating that community and having residents support one another in their recovery, become cheerleaders for others in their recovery, and creating that environment where people come home and they feel like, hey, I'm home, I'm with people who know me, who support me, and who want to see me successful in recovery and in life in general. And then through that, resident leadership is developed. So residents grow as leaders in their own recovery, and kind of pass that on to newer residents in the home. And residents have a voice in governing the home. And so this again looks different across the different levels of support. And if you are curious, because I've mentioned levels of support several times, these are the 4 levels of support defined by the National Alliance for Recovery Residences. And here in Ohio, we certify and really support level 1, 2, and 3. And level 4, under the National Alliance of Recovery Residences definitions, is considered residential treatment in the state of Ohio. So while NAR says, hey, there are 4 levels here in Ohio, we certify levels 1 through 3. And then we love our level 4 residential treatment providers, essential parts of the continuum of care. We talk about the social model with them all the time, can provide guidance and support in implementing the social model in those types of settings. But definitely we only certify levels 1, 2, and 3. And really the general differences, and we do have a whole like hour-long training on the differences in the levels, but for a broad overview, it's about how much are residents looking to each other for support versus looking to staff and other leaders for support. So in our level 3s, there's more staff. The residences are staffed whenever residents are present within the home. So is that ability, for staff to model those recovery principles, to model leadership, and residents can look to staff for that support. Whereas on the other end of the spectrum, our level 1s, there is no staff. Those are completely peer-led environments. So residents really are looking to one another for support. Now, if there's ever a situation where it's beyond what the residents themselves can handle, there is that ability to contact the operator and say, hey, we've run into something where we need more help. But certainly in the day-to-day, every day, it's the residents supporting one another. And because of this, our level 3s typically serve people who are very early in recovery. So again, they might not be at a place where they're ready to fully model recovery principles for others. So there are staff there available to model that, and then they learn that throughout their stay in a level 3. Again, with our level 2s being monitored, so there's a combination of staff and residents looking to one another. And our level 1s are mainly serving people with more recovery experience. And for us, the minimum is 6 months of experience in recovery. And so it's more appropriate for them to look to one another for support because they have that recovery experience and have practiced that ability to model recovery support. And we do get lots of questions about how these NAR levels overlap with the ASAM criteria. And if you are not familiar with ASAM, I believe it stands for the American Society of Addiction Medicine, and it is clinical criteria that's based on diagnosis, severity of the disease of addiction. And recovery housing levels are based off of measuring what's in the recovery housing environment. So ASAM looks at a person and says, hey, you person need this specific level of care. And in the NAR levels, that's talking about the actual building, the residence, where it says, hey, this is the type of supervision and support that's offered within this residence. And so ASAM, in their most recent edition, did recognize that there are some people who may need housing in order to engage in treatment. I know I'm probably speaking to the choir when I talk about social determinants of health. You can't fully engage in a treatment services or a program if you're worried about where you're going to sleep that night, who's around you when you go home, or what food you're going to eat. You can't fully engage in those measures. And so ASAM recognizes that. And then they also recognize that just because a person needs housing doesn't mean that they need recovery housing. So recovery housing includes all of those things I just described. And some people might need a housing environment where it's safe, it's clean, it allows them to, take care of their physical well-being. They're not, experiencing being unhoused. They're in a safe place, but they're, not interested in, or they may not benefit from all of the other additional things that are in recovery housing. And so ASAM recognizes that. And we recognize that too, that there are some people who just might need a housing environment that's safe and that allows them to move towards recovery at their own pace. And then there are also individuals who would, who want, who need, and who choose an environment such as recovery housing that offers the additional structure, support, and peer engagement that exists within a specific recovery housing. And so we encourage operators that any evaluation of the resident should not assume that everyone who meets X ASAM level of care criteria means that they meet, that they're a good fit for recovery housing, or that's something that they would choose, or something that they would benefit from. So they're not easily translatable, from one to the other. And again, for us, it all comes down to what is the resident need, what's their choice. And here at ORH, we firmly believe we need all of the housing. Now, we are experts in, and we certify and we promote recovery housing, which is at a very specific part of both the continuum of care for people with substance use disorders, as well as, on the housing continuum for people who need support with housing. But we recognize that there are lots of other services and supports within both of those continuums. And so certainly we need more places that are able to offer safe, affordable housing for individuals so they can focus on their health and well-being, regardless of whether or not they're a person with a substance use disorder. And then just because a person is a person with a substance use disorder doesn't mean that they would choose, or they would want, or benefit from a recovery home. Maybe they would just need that safe, affordable housing, where again, they can focus on, on their wellness and move towards recovery at their own pace, if that's what they choose to do. So we definitely, while we're experts in, and we certainly can't certify anything that's not a recovery home, we do agree, with a lot of our housing partners, we need all of the housing options. And the more that we have, the more choices people have, and the more people are empowered and can make choices, the better the outcomes they have. And so we do know that recovery housing does lead to positive outcomes. And again, we can talk for a whole hour and a half on the data and research that we have on recovery housing, but I just want to provide a brief overview that we see increased employment of recovery housing residences. Very few individuals are employed when they move in, but especially if they stay with a recovery home for at least 6 months. We see increased individuals being employed, both full-time and part-time. And of course, that leads to increased incomes, where we have many residents move in and they do not have any income at all. And by the time they've lived in the house for at least 6 months, we see great increases in income. And we also see decreased debt. And yes, for residents in recovery housing, can live in recovery housing as long as they choose. But many people, do not live in recovery homes for years. They choose to move out, before they get to staying in the home for years. Well, we do have some people, though, who have lived in recovery housing for years. And so even within a relatively short period of time, we do see residents in recovery housing decreasing their debt. So whether that's credit card fees, utility fees, court fines, they are making progress on that debt. And that is something that is really essential, because we all know that people who have debts, that is a barrier to getting, other housing. So if you have an arrears on your utilities, you may not be able to get utilities hooked up at a new place if you were to move out. Or if you have certain fines, you may not be able to get your driver's license. And then how are you going to get a job to get income to support yourself? So, or, and other types of debts, again, and, having in many housing landlords check credit scores and things like that. So just the remarkable progress that we see in a relatively short amount of time on resident debt shows us that This is, that the affordability of recovery housing is really paramount to helping people have sustained recovery capital when they leave recovery housing, and increased outcomes even after they leave recovery housing, because they've been able to reduce that barrier to employment and reduce that those barriers to wellness when they decrease their debt. And then we also see decreased substance use, which I'm sure doesn't surprise anyone. And we also see increased positive relationships with family. And there are a very low percentage of individuals who enter recovery housing who have their children within the custody of child welfare. A vast majority of individuals who have children who are under the age of 18, those children are in the care of either their other parent or with another family member. So not many are in the care of child welfare, but we do see that those that are, we see that they are reuniting, with their children. And then for those that, may have their children in the care of their other parent or family member, we do ask questions and collect data on that relationship. And a majority of recovery housing residents say that they improve their relationship, with their children, which we know is important not only for that person, but also the impacts on the next generation as well. And then we see that recovery housing saves money. So we did a study and we found that each dollar invested in recovery housing in Ohio saves over $6 and reduced criminal justice expenses, reduced child services expenses, medical expenses, and addiction services expenses. So recovery housing does save money to our communities and also stimulates the economy. And so for each dollar invested in recovery housing, over $24 is generated in the local economy over a period of 10 years, because people in recovery housing go to work, then they earn an income. And once they do that, they do things like pay taxes. So they're paying into the system. And then they use that income to purchase things in the economy. And that could be everything from going to go see a movie and buying your groceries to residents buying houses, buying cars, getting loans. And so we also see increases in credit and engaging in formal banking. Prior to living in recovery housing, many people had been unbanked, and living in recovery housing, they, establish a bank account. They establish that so they can get their paychecks and things like that. And then also just all of that spending in the local community, again, generates an investment in the local community. So our study revealed that that's about $24 per dollar invested over a period of 10 years. And then recovery housing is also workforce housing. Having an affordable living environment definitely helps residents be able to access employment. And also in recovery housing, people are helped in building both formal and informal job skills. So like I said, they work on those recovery plans, and those can definitely involve employment related goals, but then also all of the skills that people use when they're living together, things like solving minor conflicts, appropriately and politely, having that skill of setting goals and achieving those goals and, working towards those goals. Those are all essential for to be a part of the workforce. And then we also help people build workforce readiness. And so that's everything from helping people engage in education. So whether they need a GED or a certification, or they want to go on to higher education, and get a college degree. We support residents engaging in all of those avenues for education. And then also, everything from that to as basic as like, okay, let's get your documents together. Make sure you get an ID. So that way you have an ID and you can get a job and they can fill out your I-9 form. And that has really helped us see residents move from, more formal or informal employment, things like the gig economy, where they might be, engaging in, in something like in the gig economy, and blanking on an example right now, to having, a formal job where, again, they're getting a steady paycheck, and they work for an employer. So those are all things that recovery homes help do in building that building that workforce readiness. And the residents can also be a pipeline to fill needed jobs in the behavioral health system. So many people who work in behavioral health choose to work in behavioral health because they have lived experience. And so many residents of recovery housing, do go on to become peer supporters and get their education either in chemical dependency or counseling or social work and move on to work in the field. And that is a field that is desperately in need of a workforce. And so just to discuss some of the laws that apply to recovery housing, there are laws regarding landlord tenant law, building codes, employment, tax laws. All of these apply to recovery housing. There's no exemption for recovery homes from any of these particular laws. So all recovery homes are considered landlords. They got to follow their local building codes. And if they employ people, they got to follow employment laws. And as organizations, they need to follow any tax laws. And where we have seen some legislative changes is with House Bill 33, which passed over 2 years ago now and just went into effect in January 1st of this year. And this established a registry requirement where all recovery homes must complete a form with the Ohio Department of Mental Health and Addiction Services, and they must complete this form within 30 days of the first resident moving into the home. And there's also a certification requirement. So starting in January 1st, recovery homes need to be appropriately credentialed in order to operate at all within the state of Ohio. And the 3 options that they had to be appropriately credentialed are to be certified by the National Alliances of Recovery Residences, which in Ohio is through ORH, chartered by Oxford House, or have a CARF accreditation for community housing that was active as of January 1st, 2025. So, individuals after January 1st of 2025, they were not grandfathered in. So they would have to choose between the Oxford House Charter or the ORH certification. And then they must be active in the application process and open less than 18 months. So there is also this recognition that as people open new recovery homes, there's this time to allow them to become certified. So they are permitted to operate if they are a brand new recovery home, they open the home and they have submitted their application by the time the first resident moves into the home. And then they have 18 months to complete that application for certification. And then starting January 1st, 2025, any community behavioral mental health providers may only refer to recovery housing residences that are on the Ohio MOS registry. And only programs that meet the previous slide's criteria are on the registry. And that counts even if it's their own program. So even if I'm running, Danielle Gray Treatment Center, and I also have Danielle Gray Recovery Home, I cannot refer people to my own home unless that home is certified and is on the recovery housing registry in the state. And providers must also document any referrals that they make. And so a question that we're often asked is what we look for in our certification. And of course, we offer 2-day trainings and go over everything that we look for in certification. But just to summarize, there are 4 domains in recovery housing. The first is administrative and operational. So you want to see that they have appropriate policies and procedures in place, that they are registered appropriately as a business, that they have insurance. So all those administrative and operational things are in place. We also look at recovery supports. Are they engaging residents in recovery supports? Do they have strategies to help people with recovery? Does every resident have a recovery plan? So we look at those things regarding recovery supports. And then being a good neighbor. Each recovery home has to have a good neighbor practice in place. Are they following general practices to be a good neighbor? Do they have a process to address any neighbor concerns that they get? And then the final domain is physical property. So is the property home-like? Is it free from obvious safety hazards? Is it well maintained? We're not building code inspectors, so we're not gonna walk into a home and be able to tell somebody if their electrical panel is up to code. That's not what we do. But what we do is look at the property to say like, hey, is there anything obviously unsafe here? Or is there, or is this a place where that feels home-like, is furnished like a home, and where residents can engage in that recovery support that I described earlier? And so we do have an online application with a user portal that we call Roads. We do review all of the application's policies and procedures. We conduct an on-site visit and interview, and then we do a walkthrough and review of each dwelling. We do offer opportunities to make corrections if that's needed for an operator. They must follow our timelines, but if we find something that needs to be corrected, they'll get that opportunity to make corrections. And then they must become recertified every 2 years. And then we also have a complaints process. So this is something that is also newer. I believe the complaint form went live about a year ago. So it's still relatively new, but we are the front door for all complaints. So all complaints can come through ORH. And no matter, who it's credentialed by, no matter if it's credentialed at all, we will accept that complaint. And then we share all complaints with the Ohio Department of Mental Health and Addiction Services so they know what's happening. We triage the complaint and help the person with their next steps. And so if they're certified by us, we do an investigation and evaluate their certification. If they're certified by Oxford House or CARF, we pass that along to those entities. And if they're not certified, those are reported to the Ohio Department of Mental Health and Addiction Services so that they can, take action on that. And we do meet with the department like every other week to talk about these complaints. So we get a lot of them. We do want to continue to receive them. So that way, if there are issues in the community, we can help address them. And we share all that information with the department. And then if someone is not certified and they're supposed to be, or the certification is revoked, then the Ohio Department of Mental Health and Addiction Services can refer the organization to the Ohio Attorney General, and the Ohio Attorney General can seek an injunction. So ORH does not have the authority to go and seek this injunction. That is up to the Ohio Department of Mental Health and Addiction Services. But we share all of our information with the department. So if we find out that somebody is not certified and they're supposed to be certified, or if we revoke certification, we notify the department of that immediately. And then they have the ability to go to the Ohio Attorney General and seek the injunction to have them cease their operations. And just recently, a bill was passed that also allows local prosecutors to seek criminal penalties. And the local prosecutors can do that without the Ohio Department of Mental Health and Addiction Services taking any action. And so if anyone does have a complaint, I put a link here to the online complaint form. We know that the internet may not be available everywhere, or people may not be comfortable using the internet, and that's okay. They can give us a call. We can fill out the complaint form with them on the phone and answer any questions that they might have over the phone. And we also have our email address here so people can share complaints with us. I'm happy to share my contact information as well. I just encourage people to use the info at or the complaint form, because I take breaks sometimes. Sometimes I go on PTO, or sometimes I'm at a conference or in a meeting, and these emails and that complaint form go to multiple people on our staff. So if you just email me, or someone just emails me about a complaint, I might not see it very quickly. And I don't, like, if it's something that's urgent, I would want that to go to, again, these multiple people on our staff, so it can be addressed as quickly as possible. So while people are definitely, able to reach out to me, I'm happy to assist them. I do say, try to submit the complaint form or use the info at email, so multiple members of our staff can see it. And if I'm in a meeting or at a conference or taking a vacation day, that issue will be seen by somebody and addressed as soon as possible. And then if anyone needs help submitting an application for certification, if you know somebody's out there who's like, man, I did not know about this new law, I need to go and get certified. We offer a lot of support. We've got in-person trainings. I should have updated the slide with the new dates. We've got one coming up in early November. We also offer a lot of one-on-one assistance. And then we have online, on-demand trainings that people can take as well. And then also, they can just call us and we'll provide them any support. And so with that, I'll open it up for any questions that people might have. I'm not seeing any in the chat. I do see like people saying, surely you don't go on vacation. I do, and I hope everyone, if you have the ability to take PTO on vacation, take it, because we gotta, if you burn out, you can't do anything, right? So it's one of those, what do they say on the airplane? Like, put your own mask on before assisting others type situation. So, but yes, use the info at email, because again, if I'm out and there's something serious, that goes to multiple staff members.
And I'm going to stop the recordings. That way, if someone wants to ask a question and you don't necessarily want it recorded, you can do that now.